Hi, everybody. I'm Brittany Lewis, a breaking news reporter here at Forbes. Joining me now is Congressman Ami Bera. Congressman, thank you so much for joining me.
Yeah, thanks for having me on again.
I want to talk about President Trump's budget plan and specifically a real point of contention from lawmakers on both sides of the aisle, and that is the fear that there will need to be cuts to Medicaid in order to pay for the president's agenda. The Democratic Doctors Caucus held a press conference voicing their concerns about potential changes to Medicaid. You were in the caucus, you were at the press conference. Can you talk to us first about the group and the message today?
Absolutely. So there are now 6 Democratic members of Congress that are doctors. I think there's 12 Republican members. And as Democratic doctors, we feel like we've got a moral responsibility to step out there and talk about what potential cuts to Medicaid would mean to America's patients. And again, when you put that white coat on, folks trust you, and it is our responsibility to give the Democratic side of this. Now, we also know in private conversations with a lot of Republican members, they're very worried about what potential cuts to Medicaid would do. In many of their communities, the rural hospital is the biggest employee and is vital to the survival of their patients. And many of those hospitals would be severely challenged, potentially close if these cuts go through. So we are also making sure our Republican colleagues understand that.
I mean, you have a really interesting role here, having that background in medicine. What do you think then, with that doctor's perspective, is missing from this national conversation when it comes to potential Medicaid cuts?
Well, so it's important for doctors, nurses, long-term care providers to get out there and talk to their members of Congress, not here in Washington, D.C., but back home, and make sure they understand the impact if, potentially hundreds of billions of dollars get taken out of the Medicaid system. Patients are going to lose care. If they put work requirements in place, patients are going to lose access to care. So we can say this not as members of Congress, we can say it as doctors, but we also know we're members of Congress, so we have the responsibility of voting on legislation like this. So we're out there every day talking to folks.
I mean, you mentioned something really interesting, that in private conversations, Republicans are concerned about these Medicaid cuts, and there is reportedly a real point of contention between more moderate Republicans as well as more hardline Republicans in the House. Do you have any insight into those conversations? I mean, what do these conversations look like behind closed doors with your Republican colleagues?
Behind closed doors, so one of my California colleagues, David Valadeo, over 450,000 of his constituents get their health care on Medicaid. He knows that we along with other outside groups are in his district making sure his constituents know about this. And we've seen him come out publicly saying he won't vote for Medicaid cuts. Now, if he reverses that and does vote for it, that would be a damaging vote for him. He voted for ACA cuts in 2017. He lost his seat in 2018. So I think he's someone who truly understands that potential. But we're doing that around the country. A lot of this is playing out in public. The Freedom Caucus folks have demanded Medicaid cuts, and they've written a letter to Speaker Johnson. The moderate Republicans have said, hey, don't cut Medicaid, and they've written a letter to Speaker Johnson. So you can kind of get a sense of the tensions inside the Republican conference.
It seems like Speaker Johnson has a thin line to cross here, or to walk. He's reportedly ruled out a couple of the more controversial, more aggressive Medicaid proposals. But what do you make of that move from leadership? I mean, do you have a sense of where leadership's head is at when it comes to Medicaid cuts, if they are happening?
So I think they were supposed to be doing this work in committee and marking up the bill this week. Obviously, that didn't happen. Now we hear it may take place next Tuesday or Wednesday when we come back in session. We'll see if that actually occurs or doesn't. And then they've got a president who wants to pass this, what he says is a big, beautiful bill. It's a bill that's going to take healthcare away from folks in order to give tax cuts to Elon Musk and Jeff Bezos. We don't think that's going to be a winning idea for some of these more vulnerable Republican members of Congress. So I think Speaker Johnson's in a tough situation. I think some of these Republican members in more moderate districts are caught between what's best for my constituents, the people that I work for, versus what does Donald Trump want. And we'll see who wins out.
The nonpartisan Congressional Budget Office ran the numbers here, and they predicted millions of Americans are going to lose coverage depending on certain changes to Medicaid policy. So, first of all, if millions of Americans are losing their Medicaid coverage, overall, what does that do to health care in the United States?
I mean, that's going to impact everyone. So, again, we talk a little bit about what happens in rural communities, rural hospitals. You'll see community health centers that also rely on Medicaid, perhaps really stressed or closed. Those patients haven't disappeared, so they're still going to go to the emergency room and seek care when they get sick. That's going to have a downstream effect for folks that may have fantastic health insurance, but when they get sick, they may find an emergency room that's overcrowded and have to wait a couple hours, get that care. So you can't take Medicaid away from millions of Americans and not expect that not to have an impact.
President Trump has repeatedly said on the record, most recently at a town hall with News Nation, that he's not touching what he describes as entitlements, and that includes Medicaid. Do you believe him? Because it sounds like you don't.
I don't. I mean, I think they said they want to cut $880 billion out of the energy and commerce portion of their bill. There's no way to do that without attacking Medicaid. And we know that, they know that. Now, they may do some things that are sleight of hand, saying, oh, we're going to reduce the reimbursement rate to the states, and then the states are going to have to pick up that portion of it, or they're going to have to cut back on benefits, or they're going to have to drop people off of Medicaid. It is good to see some state Republican governors push back and say, hey, don't do that, because we can't pick that up and we will lose coverage. So, again, if they follow through with this, if they pass this bill, millions of Americans will lose coverage, and then they'll have to go back and defend that when those folks lose their health care and complain.
And I mean, I'm sure you've had these conversations before with your Republican colleagues where you're saying, hey, the math isn't mathing here. You've been tasked with cutting $880 billion. Something's got to give here, and that thing that needs to give is Medicaid. What do they say to that? I mean, what's their response?
I mean, we will add what they want to do is cut those benefits, take healthcare away from folks in order to give a tax break to the richest Americans, Elon Musk, Jeff Bezos, others. That's not a winning message. We're more than happy to, I wouldn't say meet them at the 50-yard line. We'll go to their 40-yard line, 35-yard line, work with them on fraud and abuse, ways to improve the efficiency of healthcare, hopefully reduce the cost of healthcare. We're in that with them. But taking healthcare away from folks is not a winning message.
And that's what Republican members of Congress have told me, that we're not touching Medicaid specifically, we're just going after waste, fraud, and abuse. And I want to read you something that the House Energy and Commerce Committee posted today. Quote, while Democrats fearmonger, Republicans are planning to strengthen, sustain, and secure Medicaid for generations to come. House Commerce Republicans are rooting out the waste, fraud, and abuse to ensure Medicaid funds go to those who truly need it. Mothers, children, seniors, and people with disabilities, not illegal immigrants or ineligible individuals. We make no apologies for prioritizing those Americans whom Medicaid was designed to serve. What do you make of their message there?
I think that's a political message. These Republican members who are going to take this vote and then go vote for re-election are going to have to face their voters. If those voters lost their coverage, lost their health care, if that rural hospital closed, they're going to have some explaining to do. And again, they're going to be asked, why did you take that vote? Why did you take my health care away? Why did you do that in order to give a tax break to the wealthiest Americans? So they'll have to live by this vote. And I hope they're right. I hope nobody loses coverage. I hope healthcare costs come down. I hope everyone has access to care. But that just doesn't seem to add up right now.
I mean, where do you think Medicaid goes from here? I mean, what do you think is the most realistic option? Because as you and I talked about, Speaker Johnson in his party is in a really tough spot here, kind of dancing between more moderate Republicans on this as well as more hardline Republicans. So what do you think is next?
I mean, this isn't going to happen, but I think I'd love to see happen is if they don't have the votes, for them to come work with Democrats. That means we are going to have to give up on some things. We're going to have to, maybe we do make some small changes to Medicaid without allowing it to lose coverage. Maybe we address the cost of prescription drugs, make healthcare more affordable. Maybe we work with the states on Medicare Advantage and other programs. There's things that we could do where we would negotiate it, and that's what I would say. This isn't great if all you do is pass a Republican-only bill, because then potentially when we get in the majority, we will undo a lot of that stuff and pass our own bill. That's just not a good way for the country to run.
In your party, is there this shared willingness to go to Republicans and say, hey, we're willing to give up X, Y, and Z if you change X, Y, and Z about Medicaid? I mean, is that the plan right now?
Yeah, I don't think you'll get 200 Democrats, but I think you can get 60 or 70 Democrats to say, let's look at the regulatory environment. Let's look at some smart things to do. Maybe there are ways to small ways to cut some of the reimbursement that goes back to states, but don't do it in a dramatic way that's going to cause people to lose coverage. We've worked really hard in California to get to almost universal coverage where everyone has access to care, and a big part of that is Medicaid. So that's a good thing. That's keeping people healthy. Don't take that away, but if we're going to change some of the benefits, then we'll work with you on that.
Well, Congressman, I know that this conversation about President Trump's budget overall is going to continue, and I hope as it develops, you come back on and join me. Thank you for joining me. You're welcome back anytime.
Great. Thanks for having me on. Be well.